Well, good morning, everyone. Welcome to the first webinar in our 8-part webinar series, Communication Strategies for Community Outreach and Education. Many of you participated in the Post-Delta Summit survey to prioritize and choose the topics for this series. In this first webinar, we'll be learning about building trust and confidence in your organization from the inside out. My name is Kim Norden, and I'm a program coordinator for the Delta Region Community Health Systems Development Program, or Delta for short. To avoid any background noise and feedback, please remain muted when you're not speaking. We'll be asking you to complete polls during our presentation. The Zoom platform also features a chat box located on the bottom ribbon. We'll ask you to share some of your experiences and best practices a little later, and you can either unmute and speak or use the chat box to add your responses. If you have any questions or comments today, feel free to use the chat box at any time. I'll be sending the slides and recording of today's webinar this afternoon. Now, let me introduce you to our speaker, Mr. Mike Mulligan, President of Legato. As a healthcare communications strategist, educator, and media trainer, Mike has directed strategic planning efforts for a variety of rural and other healthcare organizations, serving as counsel for CEOs and other executive team members. Mike is a highly requested speaker for healthcare national conferences, and he is a regular contributor to industry publications and blogs. Before founding Legato, Mike previously served in a communication leadership role for Previa Health in Green Bay, Wisconsin, and Director of Public Relations and Strategic Communications with Aurora Healthcare in Milwaukee. When he's not writing strategic communications, Mike spends time with his family fishing, kayaking, and hiking with his 2 golden retrievers. Thanks for joining us for today. And now I'm going to turn things over to Mike.
Sounds good. Well, good morning, everybody. Pleasure to be part of this program. And as Kim and I were just talking beforehand, it's really nice to kind of see this coming to fruition. And again, thank you for the input that you've had to help us to decide on these important topics. We've aligned these topics in this series to really align with what your interests and your needs are. So we certainly hope that they meet and exceed your expectations. So, just as a precursor again, that that this is part of the Delta Reach Community Health System Development Program, and so we're pleased to support that initiative and the overall the Delta program, and pleased to be a partner with you all. So as we get to this topic today, as Kim mentioned, this is about overall about communications and relationships, and really overall developing that message, that image that we've talked about. And in fact, when we look at that the survey that you did, one of the top things that came back was your feedback in terms of ways that we can build the image of our organizations. And that means different things to different people. And sometimes when we think about image, we might think of advertising campaigns or something like that, but that isn't really, certainly those promotional campaigns and things like that can be part of what you do. But what we're going to talk about today is what I would kind of consider to be more communication types of things, and more what we kind of call grassroots or almost organic types of communication, with sort of this concept that we've talked about, which is it's really communication from the inside out. So you'll see sort of a common theme that we talk about here today is really how we're going to nurture and capitalize on the relationships that we have with various audiences, including internal audiences who in many ways really serve as the ambassador of our message. So as part of that message, we're going to talk today about the value of two-way communication. And again, as I've talked about strengthening those relationships, we're going to talk about some various techniques. And I'll focus on a couple key ones for the sake of time to go into a little bit more detail. One of the things that I want to kind of emphasize for this webinar, and they always go really quickly, but as much as possible, we want to have some interaction with you as well. So we want to kind of hear from you. We're going to have throughout There'll be a chat box as well. You'll be able to put your comments in there, and Kim will share those comments. I may be able to answer them during or after, but we're going to start out here with a couple poll questions just to kind of get things started out. Kim, I'll let you kind of take it from here.
Yeah, so all you have to do is answer the 2 poll questions on the screen. And I'll give folks just a minute here to answer. And we're going to ask these exact same questions at the end of the presentation today, so we can really measure the knowledge gained. So we're seeing people with medium confidence.
No, that's great. It just kind of gives me an idea a little bit, and hopefully, you know, through this webinar, you'll pick up a few things that you might work to, you know, accelerate your communication efforts. I think, like a lot of things, when you attend an educational session or a webinar of some sort, you know, you try to look and say, okay, are there a couple kind of key takeaways that I can do? And the other thing I would suggest too is that what we'll talk about today are maybe some things that you may have done or you may have tried, and just to kind of think about, well, is there a different approach to it when we did it before? Did we do it, you know, the proper way? If we were to do it again, are there some things that we could do to kind of improve upon that? So anyway, so thank you for that. And let's see here. Okay, so one more question real quick, and then we'll get into some of the meat here. Also, if you could answer this question, what's the most important method to strengthen your image within your community? What is the most important effective method?
Okay, I'm going to end the poll now.
Right, awesome.
Like most everyone has answered.
Great.
And I'll share the results with you all. You
guys are so smart. So that's great. I mean, there's no wrong answer, but I think you see the point that that I was making here is that, you know, I'm not saying that there isn't a role for advertising, because there certainly is at the right time in digital communications and all of those sort of things. But as you have fully recognized that before we deliver on whatever messages we're sending to our community, that we have to be able to deliver on our promise. And that promise is what we obviously call the patient experience. All the communication in the world, whether or not it's grassroots types of things or it's traditional advertising or communications, whatever it might be, doesn't have as much value if you can't promote what you have in the first place, you know. So it's a lot of our efforts, and we do that as organizations. And so even as we look at sometimes when we're wanting to you know, promote different service lines, for instance, within our area, or communicate to patients regarding you know, what services are available and those types of things, we look and we say, and we're going to cover this in a later webinar a little bit in more detail in terms of kind of promotion planning and coming up with your communications plan overall. But one of the criteria is that you have to have things that are market ready. Okay, well, you might have a capacity for something, but if you don't have the ideal patient experience for whatever it might be, then those are things that obviously have to be corrected first. So anyway, good job, everybody. All right, so to kind of lead into some of the things here. So just as a quick precursor, so whether or not it's a hospital or a clinic or whatever the particular organization might be, a strong image inspires these different categories. And just, you know, it said, you know, with some brevity, that there's a sequence here that we generally see. Traditionally, like in the communications field, we have this mantra that we kind of call trial, interest, and preference. We're kind of going, you know, in that category. When it comes to messaging, we look at kind of a series of trust to confidence to loyalty to advocacy. And it's important to kind of understand this, because it really, as we start to think about our messages, our messages can evolve as well depending on who we're communicating to and at what time. So as an example, when we're first starting to communicate with potential patients, we are really just building that trust. We're okay, do they know enough about us that they're going to give us a try? Is there a reputation there, what have you? Then maybe they've tried us and they build a little bit more into, okay, I had a good experience, I'm building some confidence. And then it gets to a point of, okay, well, I know I have a lot of choices, but you know what? I'm loyal to this organization for a number of different reasons. And then ideally what you want to get is that these patients are actually your advocates, that they are out there advocating for your organization. And so we're going to talk as we get through here, a couple different programs that maybe depending on where people are in this cycle, that you can partner with community members to help to build your image. So as I've talked about, first thing is, internally, and again, a lot of emphasis that we're going to talk about here today, but this is all about relationships. This is just like in our personal lives and in our business lives, people like to associate with people with whom they trust, okay? That trust comes from delivering on what you say you're going to deliver, being honest, being transparent, all those things. So again, when we look at internal, employees, our staff, our providers, our board of directors, a lot of other audiences that you might think of, and we'll cover a couple areas here in a little bit more depth. But the point I want to make here is just always to remember that, we may have sort of our paradigm of, okay, this is how we're going to communicate, but always when you think about when you're going to communicate, just take a step back and think about all the potential audiences. For instance, we have business leaders here. It's one of the more overlooked areas I find sometimes in healthcare communications of the influence that business leaders have in the perceptions that communities have overall in your local communities. So communication. So, we're pretty used to, there's, one-way communication, and it has a purpose, definitely so. And depending on, what we're communicating, sometimes we don't need one-way or two-way communication. We need to just inform people. Maybe we're trying to persuade them, whatever it might be. But when it comes to what we're talking about today, I'm more of an advocate of two-way communications. So this, or as the diagram shows, 50-way communications or whatever. But this is where the sender and the receiver truly are listening to each other, not just hearing each other, but they're listening to each other. They're gathering, they're inputting that information, they're assessing it, and they're looking at solutions. So often, we might hear in communications, oh, well, I told the administration this, or I told them this, but they didn't do anything about it. Well, we don't know if they didn't do anything about it. Oftentimes what happens is that it was considered, but maybe it was determined that there wasn't going to be any action that needed to be taken. But the step that sometimes gets missed is the communication back. So again, this is about truly listening, taking action. Again, if you're taking action or you're responding to people, you're building that trust. So as I've mentioned, first, we want to start with our employees. It's no secret, we, providing care in rural communities, but really in, any environment, but in particularly in rural communities, our employees truly are the ambassadors of our message. We can do all the communicating that we want to do in our local communities, but our employees are the ones who are, pre-COVID at soccer games, at church with us, at the grocery store. They're the ones who are getting questions about your organization. They're the ones who are maybe repeating rumors. Oh, I heard about this. What about this? And what we want to do is equip these employees with one of understanding, being aware of what we're doing, but also being put in a position where they can confidently respond to some things as well. So we know, and there's actually clinical research to actually back this up, that better service and the way that employees feel about their particular jobs and the confidence they have in their organization, there's a not only a correlation but a causation in terms of increasing the patient experience. So this again is all about representing the image of your organization from a grassroots perspective. So when we look at the internal part of things, A lot of different things and many things that I'm sure you're doing. And again, I'm going to offer a couple insights to a few things here and then go into detail in a couple more areas. So depending on your organization, you may have an intranet, for instance, and sometimes that serves as an excellent opportunity. I've often find that some folks that have an intranet or internal sort of website don't really use that properly. They use it more kind of to put their policies and store their forms and things like that, where there's oftentimes a mechanism there where you can actually share information, post newsletters, those types of things, and you can actually have it branded to align with your website as well. So board of directors messaging and engagement, I want to talk about that for just a couple minutes. So just kind of like I was talking about with employees out in the community, obviously your board members are as well. And this is always a delicate thing because you want your, ultimately the role of your board of directors is not to be in operations. Their role is to provide strategic direction and vision. But the reality is that they are in the community as well, and people do approach them, and so they need to be equipped not only with understanding overall, what's happening, but being equipped with certain messages in terms of how they might respond. Overall, what you want them to respond to is, let me direct you to the CEO or to someone else who can get you a more definitive answer. But at least you want them to understand that and to be able to represent the right messages in the community. And you can do that in various ways, simple ways, like, for instance, from a communication standpoint, often many of our organizations will provide a monthly packet to board members of just highlights of some of the things that have been communicated, maybe some of the things that we've encountered from a communication standpoint and how we respond to those. Or it's just a standing item, maybe in a board meeting as well, if you don't want all those things written, but just that there's that kind of dialogue. So what I mentioned before, about thinking about lots of different audiences, one particular audience often overlooked, I find, is donor communications, depending on the organization that you have, whether or not you're managing a foundation. But again, very influential people, and you just want to make sure that they're open to things as well, and open and hearing information of what's happening, and just being at the forefront of information that you're sharing. So I mentioned the internal newsletters, certainly, not a new method. We did internal newsletters many years ago, but of course, many things are digital now. And, there's always a balance between, we have to look in healthcare, and we have to look and say, well, everyone doesn't have the same access. For instance, if you're on the nursing floor, you maybe don't have the ability to go in and look on site for a newsletter. And there's different ways to kind of combine those two things, of maybe having some printed pieces with things that are digital. But as dated as maybe that technique sounds, I will just tell you from experience that it still works. It doesn't have to be something very elaborate, but just to kind of hit the highlights when someone's on a break, things like that, it still works very well. This next item here, coffee with the CEO, lots of different ways that you can get creative, and we're going to talk in a second about a couple of programs, one called an employee ambassador program, and another one talking about how to really maybe elevate your employee forums. But what you want to do is look for opportunities where there's ways to make connections with your employees from a personal perspective. And this is labeled coffee with the CEO. One of the things that I would encourage, and I'll talk about in a second here as we talk about the employee forums, is to involve various people within an administrative team. Sometimes we focus a little bit too much on the CEO, but that we're elevating other folks. But anyway, the idea behind here is that, a way to really, depending on what your patient experience program is within your organization, or your quality initiatives and things like that, you may have, you know, traditional rounding, for instance, where you're going to various departments and you're doing the check-ins and things like that. Those are certainly important. They're vital. But what I've found is that they're less personal. You know, they as much as we want them to be personal, they tend to be a little bit robotic in some ways, where if in a technique like this, where you're bringing in a particular department at a time, whatever it might be, and you're you know, you're just doing that listening. You're tell me what's happening. You know, it's an open environment. Kind of want to hear what ideas you have, those types of things. And as we'll share in some of the other programs, the key to any of this and any communication is, yes, you're listening, but you also don't want to give the impression that you're just listening for the sake of appearance. There has to be a follow-up to it. There has to be, okay, I heard these things from what we heard. Here's some action that we're going to take. Or we heard these things, but here's some things we're going to do, but here's some reasons why it doesn't work. Again, lots of ways that you can get creative on this, whether or not it's coffee with the CEO, but just looking for those types of opportunities. And again, remember, this is all about ways that we're going to engage and really make our internal audiences feel part of the organization, and that they truly have a say in the direction and the messaging. Okay. So this is just an example of organization that we work with in the terms of their communications. They do this on their own, do a nice job. Very simple, but very effective for them. It's their main form of communication. One of the nice things too is with technology, and also, you know, obviously based on COVID and those types of things too, that these types of technologies often allow you to post video. And whether or not you use this forum or you just do video overall, as we all know, it's pretty easy to do that, you know, and it's just a nice personal, you know, obviously in person is an ideal way. But first of all, if you have multiple locations, multiple clinics, or you're located within multiple cities, that's not always practical. And of course, now with COVID as well, we have a lot of organizations that regardless are doing a lot of orientations and updates and employee forums and all those types of things virtually as well. And you can do that within your organization, you know, pretty easily. So as we talk about employee forums, I want to kind of go into a little bit more detail on this. So those of you on the line here, you most likely do some kind of employee forums already. In other words, you know, where you know, are we meeting regularly? Often, you know, the traditional way is maybe where if it happens twice a year, 3 times a year, 4 times a year, what I commonly see is that there's some meetings that happen where the CEO, you know, there's a meeting scheduled and employees come and they meet with the CEO, and the CEO, you know, shares some of the key information of what's happening in the organization. And even though there's an intent for it to be more, it ends up being more of that one-way communication that we talked about earlier, and not as much as the two-way communication. Sometimes, you know, there's questions that are asked and things like that, but either, and I'm just speaking from experience, I'm not saying that this is the way that it is in your organization, but that sometimes employees are afraid to ask certain questions. You know, they're not quite sure, you know, if that's okay to do. And then it actually ends up after a while kind of getting to where maybe people aren't as interested in it. So the point being that you're doing the right thing if you are doing employee forums. I think it's just a matter of how can we elevate that? So I'm kind of give you a couple just tidbits on this. And first point here is led by the administrative team, but kind of as I said earlier, this doesn't have to be all about the CEO. You know, one of the things that I learned in previous roles, I was on a management team with a multi-specialty clinic that was affiliated with a couple different hospitals. And My role, as you might imagine, was leading the communications, patient experience program, things like that. Well, our CEO happened to be a physician. He would hold our management team accountable for these employee forums, and we would be responsible for presenting various areas of our discipline, and then also fielding questions. And what it did is it helped, for one, it kind of helped to see that, to everyone else in the organization, that okay, the CEO is holding these people accountable as well. This is part of, leadership, is and that, there's an environment there where there's open communication. And the key here that I have is that, we hear a lot about transparency, and, I absolutely understand that there is a certain limit to that. I get that, that there are certain things that, maybe you can't go into as much detail that you would like to, but the point is to try to find that happy medium. And what needs to be communicated, though, to employees is that they might not always like what they hear. Okay. There's, transparency goes both ways. So that's part of what the expectations need to be. So in other words, it's, sometimes we look at employee forums as we want them to be kind of a, encouraging people and recognizing people, but it should also be very candid. So if there are things that, that's part of transparency. So if there are things that need to be improved, or, we're not doing as well on our quality scores, or, there, whatever it might be, or reporting financial performance, that and I know that many of you have learned the same thing, that you end up actually building more loyalty with employees by being transparent. Now, does it have some more things you have to deal with a little bit? Yes, absolutely. But what I found is that if you really have that environment where you are encouraging questions, and you're providing answers back, and it's in a candid way, and it's in a respectful way, that does build, it does really build, more credibility in those types of things. Now, having said that, you also do want to look for ways that you are making, I hate to say it because it is a business meeting, but you want to make it fun too. Okay, so you want to make it so that people are looking forward to it, that they learn things from them, that we are celebrating successes, we are recognizing individuals. And it's relatively easy to do, frankly, in healthcare, because there's so many great stories of how we've helped patients, right? And just recognizing people, and it doesn't always have to be some profound thing that sometimes it's the smallest of things, just to help to kind of share, those experiences. It could be something very simple of, helping a family member or whatever it might be, but just to share those experiences. So, I'm sure you do it, but just, I think some organizations do need a reminder as well, that as we do these kinds of sessions, that we are cognizant of various shifts. Okay, so that we, that we need to do these forums at 2 in the morning. We need to do them at 9 o'clock at night. We need to accommodate, different shifts and those types of things as well. So I'm going to talk in a moment now about Employee Ambassador Program and a Patient Family Advisory Council, but I think we have a question here that we want to get a little engagement in first. So the question here is, what are you currently doing to engage your employees to build support, trust, and confidence in your organization? You may be doing some of the things that I've mentioned here, or maybe they're very well, you're doing some other things that I haven't listed yet. And Kim, they just put those into the chat box, correct?
Yeah, and if anyone would like to use your voice to give us an example, you can unmute your line and
Yep,
speak
that's
up.
right. Thank you.
Daniel LaHaye says direct connects and rounding.
Great.
The MCHS team says we have been using real pictures of our staff for different Awareness Week recognitions, have our employees of the month celebrations. Social media engagement has helped them see more of what we, more to come, I think, see more of what we do throughout the hospitals, not just their department, so they see more of the whole picture.
Mhm.
L Good Game says transparency with financials and leadership rounding.
Great.
Lori Kellerman says newsletter, Facebook page and forums. Randy Dalby, CEO chats. PFAC, rounding. Gamba walks, every department employee newsletters. MCHS also does quarterly employee forums. Poston, we do rounding, internal newsletter, employee forums, and our intranet.
Wonderful. Wonderful. So like I said, we learn from each other too. And I knew that you were doing a lot of these things, which is wonderful. And like I said, hopefully, as we talk about some of these things, there's maybe a little tidbit where you say, yeah, we do that, but you know what? We could do a better job at doing this, or we could do a better job at transparency or whatever it might be. And again, I don't have all the answers here either. We have a lot of experienced people on this line that we can learn from too. And that's what this whole initiative is about. So that's great. Good feedback. All right. So what I want to talk about now is something, and you may do something like this, or you may have different variations of this, but it's something that we traditionally call an employee ambassador program. And again, what this is about is that this is again, more of a organic, or what I would call a grassroots type of effort, where you are capitalizing on the enthusiasm of various employees, of what they have for your organization and loyalty and these types of things. And I'll go through it in a second here, but in general, from a broad stroke, this is about a way in which we're developing and sharing key messages of our organization out to our greater communities by having certain employees share in their social environments, whether or not it's, at their church or card club or just something informally. This is not about everybody going out and speaking. It's about having them being equipped with certain messages that they can share informally or formally. But then again, as we've talked about this whole concept of this two-way communication, it's gathering feedback, it's listening, and it's reporting back to hospital leadership. And so we'll go into a little bit more detail on this. So generally this group, and this can change a little bit just depending on your needs and the size of the organization, but in our experience, it's identifying, it'd be 10 to 15 people. And these people are people that we recognize in some way that positively influence others in your organization. Doesn't matter to me if they're a vice president or what have you. In fact, I would prefer that it's not weighted heavily in senior management or things like that. It could be anybody at any level that influence people within your organization. And so the traits that we're looking for are, again, demonstration of leadership. And as we know, our definition of leadership, again, is not a title, it's a behavior. It's how do we positively influence people? That they are a support of your organization. They're greatly involved in the community. They know people. I'm sure as we're going through this, you're thinking of people already that would probably many of the people on this call, because I know many of you are in those types of roles as well. But the idea then is that we're positioning this ambassador as really, they are being recognized because of their behavior already. They're being selected or chosen. And we've had organizations where, there's a process where people are nominated or elected for this or whatever, or they're just specifically chosen. But again, it's an honor within organizations to have this role to serve as this ambassador. So then, and we'll talk a little bit more about how the communication works on this. But in general, what we're talking about again is that we are equipping these ambassadors with various messages. They could be messages that we know that we look at our communications plan, or points that are maybe part of our strategic plan, of things that we want our community to know that we know they don't know already, or maybe there misunderstandings. There's always misperceptions. I don't know how many times in rural healthcare organizations where no matter what we do, the community isn't aware that we have this service or that we do this, so those types of things. Also, it's to quelch or counter rumors that might be happening as well, things that we're hearing in the community. And sometimes even folks at an administrative level, although they're in the know of a lot of things internally, they may not be as connected in terms of what's being said in the community, and having that knowledge is invaluable. So what we do after those folks are identified is we do some upfront training, if you will. And it's really, what I suggest that you do is, first of all, you're recognizing them, your overview of what the program is already, kind of talking about what your expectations are of them. It doesn't have to be, overbearing as well. Generally, the group here we have it meeting bi-monthly at the beginning, but as you go on, you could do less frequently, and kind of just talking about the responsibilities that they have. What we often do is we recommend is that you match up different people's interests with what you might have them do. So as an example, one of the things we want to look for is, okay, if they're already active in certain groups, then we want to say, we're not going to ask you to go out on the speaker circuit, but as you're maybe communicating with various people or you're having some interaction with them, we just kind of want to have you equipped with these messages as things come up. Oftentimes, one of the ways, frankly, is social media. There's, as we know more and more, there's all kinds of community groups and things like that, Facebook groups, other groups where there are messages that are going out. Sometimes that's a way that we're doing it, and sometimes it's the traditional ways. But anyway, as part of this upfront training, we're identifying together. It's not administration saying these are the messages, but it's also getting their input and saying, okay, what are some of the things that we believe that we need to communicate to our communities? Now, we do match that with things that are part of our strategic plan or part of our communications plans with our organization, try to match those things up. And then, we equip them with, okay, here are some of the questions, here are some ways to answer that. And then we can go as far as actually helping them train, rehearse about how to answer those types of things, and just making them feel uncomfortable in the various environments that they're in. So then we have what we have now is kind of bi-monthly meetings. And this is where, again, that two-way communication part comes in. And this is critical. We're getting people back together. First of all, we're reviewing up front, depending on where we are, what these key messages are, those types of things. We're identifying ways to communicate those messages internally and throughout the community. But then we're discussing, after they have gone out into the areas, we're truly discussing, what have you heard? How did it go so far? What kinds of things, what was the response when you said this? And what we're looking for there is some trends, okay? And in that group, we want to make sure there's a representative from administration, senior management, who's part of that process. So he or she is hearing this firsthand. But then we want to create, some kind of an action plan. Okay, based on what we have heard, is there anything that needs to be changed operationally, or is it a matter of just misperception and we need to do a better job communicating? It all depends. And I'll give you an example here of a hospital and kind of what some of their scenarios were. But as I kind of mentioned before, in terms of building that trust, it's responding to all the ideas in some way. It doesn't mean that you're going to take action on everything. Sometimes or that you're going to take action by responding. But, for instance, if someone comes in and they get feedback that, I don't know, you need to totally redo your parking lot, whatever it might be. Well, doesn't mean you're automatically going to take action and invest millions of dollars in redoing your parking lot. But what it might tell you is, there is a common theme here in terms of parking, and maybe there's some things that operationally we need to think about. And, maybe it's signage or whatever it might be, but it's just learning from that. But then what we want to do is that as those ambassadors are understanding what the solutions are, then when they go back to those groups, they say, appreciate your feedback. I just want to let you know that I did bring this back, and here's what we're doing about it right now. And what we might be doing about it, maybe we're studying it right now. Maybe we don't have a solution for it, but we just wanted to let you know that we're listening and we're considering it. So you kind of see this flow here. If you look at the top, again, as we kind of look through this process, at the beginning here, we're identifying those messages, okay? And if you go then, clockwise, we're sharing those messages, we're listening, we're asking questions of those people in those groups as well. We're coming back to our community ambassador group or employee ambassador group, we're sharing that feedback, we're looking for trends, we're analyzing those trends. Based on that, we might shape future messaging. And then we do the follow-up again with answers to the group. So as an example, organization that we work with, maybe many of you may be familiar, being in Illinois, is Rochelle Community Hospital. And we've worked with them to develop their employee ambassador program. And, a couple takeaways on this is, our whole theme of the webinars that we're doing here is about improving, our image within our community. And, I guess coincidentally, that one of the reasons that they wanted to take this on is because, as I'm sure many of you, one of the things in their strategic plan is a goal of, quote unquote, continuing to improve their image within the community. And this fit right into that. A lot of other things that they're doing that fit into that as well, but this is one of the main things. So just as we've advocated, they started an employee ambassador program. They actually have started with monthly meetings, and then as this has gone on, they've moved it a little less frequently. But just to give you a couple of examples when we kind of talk about that communication cycle. So some of the messages for them, they had a new clinic coming in, they wanted to accommodate, they had maybe some misperceptions in the community a little bit about, the space or access to visiting specialists, those types of things that sort of came up. Access to primary care, and maybe some people not understanding at that time in terms of their convenient care and what that was. Maybe some questions in the community regarding communication or access to residents who where English is not their primary language. Just various things that would come up, and then from there, as I mentioned, sometimes it's an operational thing. There would be things that we would discuss where it would go back to administration, or it might go back to a different group. Like, for instance, on the, speaking Spanish at local hospital and sponsored events, this organization, as I'm sure you do, has a separate kind of group and committee that's really focused on, multilingual needs. And so this feedback came back to that group as well, and we involved that group in the solution for this. And so what you see here on the upper left is just an illustration, though, of what, some of those key messages were that we shared with people, and we kind of equipped them with the right messaging. So in this regard, then, we kind of provided a lot of those answers, but then some of the feedback that we got from people, for instance, were, develop an easier and streamlined approach to new patient and transferred patient registrations. Stagger lunch hour breaks for the clinic so that people aren't left waiting. If there's, these are, basic things, but they're things that we learn as we're kind of in the details of our positions. That sometimes, we may hear one thing, but once we hear it a few different times, we learn and we see some trends. And that's going to be similar to what we'll talk about in a moment here, which is the patient advisory council, which I see from the feedback, many of you are doing that already. So in fact, that is a way, the patient advisory community, in which we do really, another way that we connect with the community. You very well may be doing something like this, and I just want to give you kind of a couple takeaways on this. This is a way, again, where this is how we can, another way that we engage with our community. And in general, what these are, community groups that we, a group that we would kind of designate. Again, the same idea is that these people are really being recognized for their participation in a program like this, and that we are, again, it's a mechanism where we truly are listening to them. And there's part of this where, again, we are gaining understanding, we are listening, but we really are learning. You know, that's what we want to do. We don't want to do this just for the sake that it looks good to the community, but we want to use it as a tool for us. That tool can be anything from getting feedback on, you know, operational things, could be registration, could be how the phones are answered, things like that. Or it might be testing communication messages as well. So, or even, oh, we have this new communication program that's going to go out that's going to, you know, explain our COVID protocol. You know, could you give us some feedback on this? How does, you know, and again, these are this is an advisory type of thing. But as we look at this type of thing, what we want it to be is also an eclectic group. The goal here, whereas maybe with the employee ambassador program, I kind of advocated that we want to put, you know, just all champions of our message on there, if you will. Here, that isn't as critical. You know, we actually, you know, maybe there's some people that maybe was someone who was a former patient or what have you, or somebody that maybe isn't as positive about our organization. We want to have that cross section of, you know, as long as they're respectful and those types of things. And we want to have that diversity in this council. And the other thing to kind of think about is just as we select these folks is, you know, certainly as we look at areas that we're trying to communicate to, think about different geographic regions. Well, you know, we have the satellite clinic. Do we have anybody that represents a person that's in that satellite clinic? Do we represent different cultural backgrounds? Do we represent different genders or age? Those types of things that all can affect, you know, how we might communicate or the messages that we share. And then, as I've mentioned, though, this is a way that we really want to kind of select these people and make it an honor to do so. Oftentimes what we've seen is that, you know, we'll kind of do some, you know, some discussion up front, but then what works really well is to have the CEO personally invite these folks to it. So it might be, you know, a personal call, bring them in for coffee, kind of talk about it. And people feel a lot more honored to do that. But again, just kind of like what I mentioned before, I don't have any issue at all with having prominent people in the community on this type of council, but I would just caution you that it doesn't get overly political. So there can be people of different backgrounds, different educational levels. This is not, you know, this is really to gain information. And, you know, for instance, you know, I'm not saying you can't do it, but I wouldn't have a lot of members be spouses of a prominent physician or something like that. I mean, you kind of get the idea. You really want it to be apolitical as much as possible. And again, this advisory group doesn't have decision-making skill or ability, but they can influence and they should influence what you do. And again, just like in the other one, we want a process where there's feedback, we're demonstrating listening. When we meet on it the next time, we're letting them know, okay, here's what you told us the last time. Here's the steps that we've taken. Here's the action that we've taken. Because the last thing that you want is where, you know, people might feel that, boy, they had this session, but they didn't do anything about it. You know, you just want to have that communication. So I'm going to ask a question here, and then we're going to go through. I got a couple slides here, but I want to make sure that we have time for questions as well. So this one is add an answer in the chat box. What are you currently doing that has been successful for you to engage your community?
And you can use the chat box or you can unmute and use your voice. And I just want to remind everyone too, if you have any questions for Mike that have arisen, or any questions for Mike, feel free to drop those into the chat box and we'll address them at the end. Linda Brazel added a community member to the quality committee. Vicki Brandsetter, we formed a coalition.
Sorry.
No, that's all right. Vicki Brandsetter formed a coalition, Iron County Health Coalition. El Good Game, we do have a patient advisory council.
Wonderful. Great. Hopefully some of the things that we talked about today were insightful for you. Great. 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 Good to know. Let's see here.
Oh, Randy Dalby at Pinckneyville, Community Care Coordinator, members of the community on various committees. The MCHS team, we've started our community care coordination activities where they've pulled in several leaders for discussions, feedback, etc. They're also active in the area by volunteering at events, involvement in civic clubs and organizations, and sponsorships.
That's fantastic. And that's something that we didn't address here, but one of the areas that I would encourage you as well is when you're looking at activities that you're doing in your communities. Again, it's harder right now because of COVID, but that you're actually, I kind of talked about that accountability, but as a leadership team, that various members, and it doesn't just have to be senior leadership, but various levels, that they have some responsibility and accountability for being involved in the organization as well. And I've seen organizations where that role, that accountability actually gets tied in to their expectations for their performance reviews as well. So that's excellent to hear. Great. Okay, well, thank you. Good feedback. So I'm going to just go through pretty quickly a couple other things here. And it sounds like some of you are, or maybe all of you are doing some things like this already, but just as a reminder, some things, again, we're talking about here, ways to engage in the community from a grassroots or communication standpoint. So with the advent of COVID, of course, a lot of things going virtual, and we have a number of organizations now that are doing their education virtually as well. And so that's something that we have to kind of think differently about, and how do we do that, and what does that look like? And just because we're not bringing people into our facilities doesn't mean that we can't get creative about it. It's also a nice way, if you haven't done like a virtual tour of your organization, that can be part of it when people are going online to register, that they can actually see your organization online, those types of things. I saw in the comments, a lot of people are doing a lot of things via social media and all of that, and that's wonderful. You can see here some examples of that. This one on the left here is a customer of ours in Idaho, and this Nurses Rock thing actually came up, that they don't know where it came from. Somebody just found it there. It wasn't even a planted thing. Like someone like did this, and it was just sort of a coincidence sort of thing, and it was just so perfect. Again, upper right here is a CEO giving a message as well. And one of the things that we found in terms of building confidence is, as you're sharing video messages with your community or your employees, that to have that balance where some messages are being shared from a clinical perspective and some from an administrative perspective. People really are kind of looking for that confidence. A couple other examples here, again, things that you can take away or are doing as well, just in terms of how you're using social media. I think, one of the advantages that we have, if you will, in terms of being in rural health, is that we do have the ability to really build our brand by demonstrating what we're doing to help our communities. And it really builds that loyalty long-term as well to your organization. And so, and in many ways too, as we know, we have a lot of small businesses that are hurting in our communities. So whatever we can do to demonstrate our support for them also builds goodwill for our organizations. And having said that, it doesn't mean that we still couldn't and shouldn't continue to do different programming to encourage screenings and community education and these types of things. You probably do similar types of incentives. This one in particular is, kind of an incentive to have some muffins and mochas. We've done mammos and manicures, but again, this is an idea where not only is it an incentive for people, but it is a way to promote and encourage one of your small businesses as well, to kind of that may be hurting due to COVID. Publications continue to be a very effective way to communicate broadly to our communities. And even though we focus a lot on digital in our communications, these tools really help to engage with our communities because we can tell those patient stories in a more thorough and an in-depth way. And overall, whether or not it's a publication or in your communications, we need to continue to, yes, we are promoting or communicating about our services, but in terms of that trust and loyalty, we want to be communicating, you know, a level of confidence that, you know, the care that you are providing and that they can be reassured that you're doing everything as possible to make sure that, you know, the patient's safety is the number one concern. You may be very well sharing, you know, and doing, I just advocate again, I mentioned videos before, whether or not it's patient videos, provider videos. It's one of the more effective ways in healthcare communications because it demonstrates empathy. It's just believable. Again, I kind of mentioned earlier business health as well, that we don't want to forget about that audience. A lot of things that can be communicated, education that we can do at area employers. Again, we can do a lot of things virtually now as well. So just an audience to keep in mind. So just to summarize, so we have a couple minutes if there's any other questions. Some of the takeaways here again is that as we're building that image, we kind of go through that process of trust, you know, building confidence, building loyalty, and ultimately having them be an advocate for you. And when I kind of always focus on that two-way communications, always kind of being cognizant of that. Always remembering as well that employee engagement and satisfaction is vital to whatever we're going to communicate. It also ultimately results in better patient experience results. Lots of techniques to use, including brand ambassadors to share your values and your message. If you're doing that, great. If you're not, I would encourage you to do so. Patient Family Advisory Council, and a lot of the other things that you've mentioned here, some of the things that you're doing, fantastic ideas, keep them up. And again, to kind of look at, you know, virtual engagement as a way for the future. So I know we do have a final poll question here. So
Thanks so much, Mike. And as we're wrapping up, do you want to talk about what's next, our second episode in the series?
You bet. So as you mentioned, we have an 8-part series. And so this next one is going to be focused a little bit more on professional development. We thought it'd be kind of a nice angle to this of what your role as a communicator is in your organization and how can you provide the most value you know, to your senior team, and what are some traits and behaviors and things that you can learn. So that came up also as an interest in the survey. So we're looking forward to sharing that with you as well.
All right, well, thank you so much, Mike. This was an excellent presentation, and we look forward to the next one next week at the same time in the same place.
Great. Sorry, I went a little long. So if you have other questions, you can certainly reach out to me as well. And in fact, the Resource Center can certainly share my contact information, but it's here as well. If you have other questions that we didn't have time to address, I'll be happy to answer those for you. So thank you all for taking the time. It was a pleasure.
Thank you, everyone. Have a great afternoon.
Take care.